Hello everybody. So today we are going to discuss general physiology. So in general physiology, the first topic that we'll be discussing is homeostasis. So all of you know what is the meaning of homeostasis, right? So it is maintenance of nearly constant internal environment of a cell, or we can say constancy of internal environment of a cell. Any parameter, it may be pH, it may be temperature, any parameter, one cell can maintain its internal environment constant. But for MCQ purpose, we have to remember that the first concept of homeostasis was given by scientist Claude Bernard. He introduced one term which is known as the milieu interior. Milieu means environment and interior means internal environment. According to Claude Bernard, you remember that according to Claude Bernard, suppose this is a cell, the cell maintains its internal environment constant, which in turn depends on the immediate external environment of the cell. What I told? I told that according to Claude Bernard, according to milieu interior concept, the internal environment of a cell depends on the immediate external environment of the cell, which is nothing but the interstitial fluid, right? So if you change the composition of the interstitial fluid, your internal environment of the cell is also going to change. And according to Claude Bernard, this milieu interior or the homeostasis concept is mainly depends on interstitial fluid environment. So this was an MCQ, that homeostasis or internal environment of the cell depends on, your answer will be interstitial fluid. But you remember that Claude Bernard introduced the term milieu interior. The literal meaning of this milieu interior is homeostasis, but he didn't coin the term homeostasis. So that's why there is another MCQ, that who for the first time coined the term homeostasis, and your answer will be Walter Bradford Cannon. So these two MCQ already been asked in your exam, so please try to remember this. Now the next concept is that how a cell maintains the homeostasis, how a cell maintains the internal environment constant. For maintenance of homeostasis, you know there are control system in our body. The control system mainly are of two types. One is feedback type of control system, and one is feed forward type of control system, right? So feedback control system, again it is of two types. One is positive feedback control system and other one is the negative feedback control system. I'll give example, but first you try to understand. Suppose I am writing one reaction. In this reaction, A is producing B and B is producing C. So C here is the output. By definition, feedback system is that system where the output return back to give input so that the next action is going to change. Getting my point? So C is the output here. If the C is returning to give some input either at the level of A or B so that the next action is going to change, that kind of system is known as the feedback system. Now if this return back input is of stimulatory type, then that will be known as the positive feedback control system. Getting my point? So suppose C is stimulating B and again B will produce C, and again the same thing is going to happen. So the pathway will move in the same direction again and again. This kind of system is known as the positive feedback control system. This is also known as vicious cycle. So according to positive feedback control system, if I take one example, that suppose our blood pressure increases due to certain reason, according to positive feedback control system, this increase in blood pressure will stimulate further rise of blood pressure, and that will again increase more blood pressure, and the blood pressure will continue to rise, and the disastrous consequences is going to happen. But that does not generally happen, right? In blood pressure control system, it is not the positive feedback control system. So that's why we say that positive feedback control system destabilizes our control system. So please remember that positive feedback control system is not very good. It tries to destabilizes our control system. If blood pressure is rising more and more, so some disastrous consequences is going to happen. So what I require a system where this increased blood pressure will not stimulate further rise of blood pressure, but rather it will try to decrease blood pressure so that the blood pressure will be stabilized. And that type of system is known as the negative feedback control system. So in negative feedback, C, which has been produced here, that is going to give input to the level of B, and that kind of input is inhibitory input. Or maybe this C will return back here at the level of A, and it will try to inhibit the A so that the next action is going to change. So this is a negative feedback control system. And negative feedback control system is more prevalent in our body because it tries to stabilizes our control system, stabilizes different parameter in the body, right? So that's why you will see many control system are mainly of negative feedback control system, but positive feedback control system are limited. Okay, there are certain conditions where positive feedback control system are beneficial to the body. Getting my point? So positive feedback control system tries to destabilize the control system, but there are certain conditions where positive feedback control system are beneficial. So first we will look at what are the examples of the positive feedback control system, and after that we will come to this feed forward control system. So the examples of the positive feedback control system are written here. The process during blood clotting. You know that if you remember your intrinsic pathway of coagulation, we'll discuss this thing in the blood physiology chapter in detail, but for the timing remember that in intrinsic pathway of coagulation, when factor 10 is produced, okay, factor 10 stimulates the prothrombin, and prothrombin produce thrombin, right? Whenever this thrombin is generated, thrombin can activate multiple clotting factor like factor 5 or factor 8, and all these clotting factor again in turn will activate this factor 10 so that more and more thrombin will be produced. So what we are seeing here, that whenever a little amount of thrombin is created, that thrombin is giving positive feedback on factor number 5 and factor number 8, and more thrombin is going to be produced. So this is an example of positive feedback control system. Then we all know that estrogen has positive feedback on LH just before the ovulation. Otherwise, we know that during the whole menstrual cycle, estrogen has negative feedback effect on FSH and LH. But just before ovulation, only 1 and 2 days before ovulation, the estrogen stimulates the LH and FSH production, and that helps during the ovulation spike. Okay. The third is the uterine contraction during process of childbirth. You know that whenever the uterine contraction occurs, okay, that pushes the fetal head towards the cervix, and that causes the stretching on cervix. That stretch on cervix stimulate one neural signal which ascend to the level of hypothalamus and which stimulate the synthesis of oxytocin hormone. That oxytocin hormone produce more uterine contraction, and whenever there is more and more uterine contraction, the fetal head will be stretched, the fetal head will be pushed towards cervix and cervix will be stretched. So this way, again, this is a kind of positive feedback control system occurring. Next is the lactation. You know that during the process of lactation, the similar kind of mechanism will happen, that whenever the baby is suckling near to the region of the areolar region of the breast, what will happen? A positive feedback control system will be initiated, which will produce oxytocin, and that oxytocin will causes more ejection of the milk and again more suckling, and this way the positive feedback control system operates during childbirth. Generation of the nerve impulses. Next is the generation of the nerve impulses. Very, very important. Please remember that when action potential occurs, you require a channel which is known as the voltage gated sodium channel. This opening of the voltage gated sodium channel is an example of positive feedback control system. Why? Because this sodium channel, which is a voltage gated, it opens in presence of depolarization. So whenever there is little depolarization, what will happen? It stimulates the opening of the sodium channel. Through this sodium channel, sodium will enter into the cell. That sodium, because it is a positive charge, it will produce more depolarization, and more depolarization means more opening of voltage gated sodium channel. So what we are finding out? That opening of one sodium channel is producing depolarization, and that is stimulating opening of another sodium channel. So again, it's a positive feedback control system. We'll be discussing this thing in detail during the action potential chapter. But for the time being, you remember that opening of sodium channel is an example of positive feedback control system, right? And next is the release of sarcoplasmic calcium through ryanodine receptor during excitation contraction. Again, this is a detailed topic which will be discussed during the muscle physiology chapter, but for the timing you remember that if this is your sarcoplasmic reticulum, right? Suppose this is a sarcoplasmic reticulum with two spherical ends. Okay. At the end, at the spherical end, there is a receptor which is known as the RYR or ryanodine receptor. If this receptor is open up due to certain reason, I will tell you what is the reason later on, but what will happen if this channel is open up, then calcium will be released from sarcoplasmic reticulum into the cytoplasm. This calcium is a stimulus for opening of more RYR channel. So what will happen? Whenever you open up a little amount of RYR channel, calcium will influx to the cytoplasm, and that calcium will stimulate further opening of RYR channel, and a positive feedback mechanism will set in, which will rise intracellular calcium to a very high level, and that will produce the muscle contraction. This kind of mechanism is particularly prevalent in cardiac muscle. We will be discussing this mechanism in detail in muscle physiology chapter. So these are the positive feedback control system examples written in front of you. You have to remember all of this example, okay? Because I told you that positive feedback mechanism are limited in our body because that tries to destabilizes the system, but there are certain conditions like here. In all of this condition, the positive feedback is beneficial rather than destabilization, right? So this is all about positive feedback control system. Now coming to the negative feedback control system, you all know about negative feedback control system. So negative feedback control system examples are many. But typical examples we give from endocrinology, right? You know, if I give a very simple example, that from hypothalamus, thyrotropin releasing hormone is produced that stimulate the pituitary production of the TSH. TSH stimulate the thyroid gland for the production of T4 and T3. and then this T4 and T3 has negative feedback effect on TSH production as well as on TRH production. So this is a typical example of negative feedback control system. In endocrinology, you will see the examples, many examples of the negative feedback control system. So I am not going to go into detail. But under negative feedback control system, you have to understand one important thing, and that is known as gain of the control system. Gain of the control system. With help of gain, we can understand what is the effectiveness of a control system, right? So how the gain is calculated? So gain is equal to correction upon error, right? You must have to remember this formula, that gain is equal to correction upon error. But what is the meaning of that? We'll take an example. So suppose the blood pressure of a person, so this is y-axis, this is x-axis, okay, and this is y-axis. Y-axis is recording the blood pressure. Suppose in steady state condition, the blood pressure of a person is 100 millimeter of mercury. So this is 100 millimeter of mercury, right? Now we have infused some amount of blood in this person, due to which the blood pressure of this person is raised up to 160 millimeter of mercury, right? So due to infusion of blood, the blood pressure has raised to 160 millimeter of mercury. Great, right? Now we all know that during this condition, baroreceptor will try to reduce the blood pressure, and baroreceptor is effective. Suppose the baroreceptor has reduced this raised blood pressure to 120 millimeter of mercury. 120 millimeter of mercury. Getting my point? So whenever your blood pressure is raised, baroreceptor will be stimulated. It will try to reduce your blood pressure. So suppose blood pressure has reduced, but it has not been reduced to 100, it has reduced to 120 millimeter of mercury. Okay, so at steady state condition, the blood pressure was 100 millimeter of mercury, and baroreceptor tries to correct it, but he has not corrected fully. Still some error is there in the system. So now if I ask you how much error is still remaining after the correction of baroreceptor, we can easily answer this condition, that error is remaining, and that is 20 millimeter of mercury, right? So it was supposed to be 100, but baroreceptor has reduced is to 120 millimeter of mercury. So error or disturbance is still remaining, and that is 20 millimeter of mercury. So if I want to calculate the gain from here, so G will be equal to correction upon error. So error we have detected, that is 20. And how much correction the baroreceptor has done? So without baroreceptor, the blood pressure was supposed to be 160 millimeter of mercury, but with baroreceptor, the correction has already been happened. And how much is the correction? From 160 to 120 millimeter of mercury. That means I can understand that 40 millimeter of mercury correction has been done by baroreceptor. So correction is equal to 40. So 40 upon 20. So gain of this baroreceptor control system is 2. Now if I look at the direction of this correction, so blood pressure is rising in this positive direction, and baroreceptor is trying to correct in the opposite direction, in the negative direction. So obviously this gain is a negative gain. So I can say that in this example, the gain of the baroreceptor control system, the gain of the baroreceptor control system is -2. Getting my point? So please remember this formula, that gain is calculated by correction upon error, and that is correction here is 40 and error is 20. So why we calculate gain? We calculate gain to assess the effectiveness of the control system. More the gain, more is the effectiveness of the control system. Now, you imagine a condition where the error is 0. Could you imagine? Getting my point? What I'm saying? Suppose I have found out one control system where correction is 100% and residual error is 0. So what will be the gain? The gain will be equal to infinity. Getting my point? So whenever a control system is so effective that the residual error is 0, then the gain of the control system is known as the infinity gain. Could you imagine certain conditions, certain control system in our body like this? Answer is yes. The example of a control system which has infinity gain is kidney. Please remember, kidney is a very slow system. Okay, for regulation of your blood pressure and for regulation of your blood volume. Remember, so for regulation of your blood pressure and for regulation of your blood volume, okay, the kidney is a very slow system. But if you give enough time, the kidney is capable of maintain your blood pressure without any residual error. Suppose your blood pressure is raised to 160 millimeter of mercury in the previous example. If you give enough time to kidney, the kidney will slowly excrete the excess amount of water from the body and the blood pressure will return back to 100 millimeter of mercury, what was the original one. That means the residual error is 0. That's why we say that kidney, for regulation of your blood pressure and for regulation of your blood volume, the gain of kidney is infinity gain with a residual error is equal to 0. Right? So this is very, very important, which has already been asked in INI-CET type of examination, that infinity gain is for which? Okay, infinity gain is for kidney for regulation of your blood pressure and blood volume. Right? So this is gain. Now, apart from gain, certain books has given another factor, okay, which is known as regulation factor, So we have understood gain, right? Now another factor I am saying here, that is known as the regulation factor. So we have discussed gain already. Okay, regulation factor, you are not going to get this in common book. This is given in the BGIMER's textbook of physiology. Regulation factor check the accuracy of the control system. Getting my point? So gain is basically checking the effectiveness of the control system. The regulation factor is checking the accuracy of the control system. So what is regulation factor? So regulation factor is equal to, you have to remember the formula, the change with control system and change without control system. Okay, so change with control system and change without control system. Right, getting my point, what I'm saying. So in the previous example, if I go back here, okay, so if the baroreceptor control system is not there, then whenever you are infusing the blood in this person, the blood pressure is supposed to rise up to 160 millimeter of mercury. Okay, that is change without control system. But because the baroreceptor is there, it is bringing back your blood pressure way back to 120 millimeter of mercury. So that is change with baroreceptor control system. So now if I want to calculate from the same example, if I want to calculate R, so change with control system, change with baroreceptor, how much change? It has, the baroreceptor has reduced the blood pressure to 120 millimeter of mercury. So how much change is still there? That is 20. That is change with baroreceptor. If the baroreceptor is not there, how much change is going to happen? The blood pressure is going to change from 100 to 160 millimeter of mercury. That means 60 millimeter of mercury blood pressure change is going to happen if the baroreceptor is not there. So change without control system is 60, but because the baroreceptor is there, the change is not 60, the change is only 20 millimeter of mercury. So basically the error upon the change without control system, we can say like this. So this is basically 1/3. Please remember the accuracy of the control system is inversely related to the regulation factor or R. Okay, more is the regulation factor, less is the accuracy. So how we can calculate the regulation factor or accuracy? I already told that you have to remember the change with control system upon change without control system, and that is known as calculation of the regulation factor or R. Right. Getting my point? So these two things you must have to remember for your exam point of view. Right. In AIIMS, one question was given. Okay. So I'll discuss another example. In AIIMS entrance examination, question was given like this, that due to certain reason, the blood pressure of a person fall 10 millimeter of mercury. So they are giving direct fall of blood pressure, and the blood pressure is falling 10 millimeter of mercury. But due to control system, the person is again gaining the blood pressure, and how much gain is occurring? That is 8 millimeter of mercury blood pressure gain is occurring. Getting my point? So they are not giving you what is the basal level of blood pressure, but they are directly saying that due to certain reason blood pressure falls 10 millimeter of mercury, and due to baroreceptor control system the person is again gaining the blood pressure, and that is 8 millimeter of mercury. So in this example, if I try to calculate the gain first, okay, gain first. So gain is correction upon error. So how much correction has been done? The correction has been done here. That is the 8 millimeter of mercury. That is the correction. And how much error is still persisting? This is the error. Okay. Fall is 10. Correction is 8. So error is persisting. That is still 2. So gain here is 4. And again this is the negative gain. Again this is a negative gain because the correction is occurring in the opposite direction. But if I try to calculate the R, okay, R, that is the regulation factor from the same example, then I told change with control system. So how much change with control system? That is 2. And change without control system, that is supposed to be, right? So 10. So 2 upon 10, that is the 1/5. Getting my point? So this way you can calculate the regulation factor or R. Very, very important, right? So this is all about the negative feedback and positive feedback. Now we are coming to feed forward control system. I told you already that feed forward control system is anticipatory control system. Okay. When the control system predict that some change is going to happen and you are taking some corrective measure before the change, that is known as anticipatory control system. So you must have to remember this word. Anticipatory control system is known as feed forward control system. I give this example, very common example. Suppose in winter you are returning from office to your home, and you know, because it's a very cold, very cold, what will happen whenever you will enter in your room will be cold enough. So if you have some system by which you can switch on the heater in your room before before entering in your room, if you can switch on your heater, so what you are doing? Because you know that your room temperature will be very, very chill and cold, you are switching on your heater system. You are taking some precautionary measure so that your room, because you know that your room temperature will be very, very chill and cold, you are switching on your heater system. you are taking some precautionary measure so that your room temperature is raised before you enter in the room. This is a typical example of feed-forward control system. Look at here, the examples are written, the feed-forward control system. First example is written is thermoregulation system. Remember, thermoregulation system, it has two components. Feed-forward control system is there, feed-forward component is also there, and feedback component is also there, right? So thermoregulation control system, it has both feed-forward also and feedback also. We'll understand how it happening, right? So, you know that there is something which is known as core temperature, core body temperature, okay? The internal temperature of our body, the temperature in and around the vital organs in our body, that is known as the core body temperature, and that remain constant at 37 degrees centigrade. Okay, the thermoregulated system always try to maintain the core body temperature constant. But apart from core body temperature, we also know that there is something called skin temperature or shell temperature. This skin temperature can changes according to your environmental temperature. But the prime target of the thermoregulatory system is to maintain the core body temperature constant, because that is more important. So take one example. Suppose in a winter season, the environmental temperature is very, very low. Okay. So whenever the environmental temperature is low, suppose 4 degrees centigrade or minus 4 degrees centigrade, whatever, it will decrease the skin temperature also. Now there are certain thermoreceptors which are present at the level of the skin. So there are certain thermoreceptors which are present at the level of the skin. This thermoreceptor will detect the fall of temperature at the level of skin, and it will send some signal to the thermoregulatory center which is located at the level of hypothalamus, and then the hypothalamus will activate certain system which will produce heat, like for example shivering, vasoconstriction. So all this system will be activated, okay, and that will produce heat. So it will produce heat production, and this heat production will rise the core body temperature ahead of decrease in core body temperature. Getting my point? So look at the logic. So your skin temperature is dropped. Your core temperature is not dropped yet. So your core temperature is still constant. But your skin temperature, because it is down, the body, the control system has detected that if you don't take precautionary measure, after certain point of time, your core body temperature will also fall. So you take some precautionary measure, you take some anticipatory measure so that you can rise your core body temperature before the fall. And that signal is going to the level of hypothalamus, and hypothalamus is producing heat, and that heat is rising the core body temperature ahead of fall. And this is the typical example of feed-forward loop of thermoregulation. Getting my point? And this is the very common one. You know, whenever there is a decrease in the environmental temperature, your core body temperature is not going to be decreased, because this anticipatory feed-forward control system is there. But suppose you have exposed to a very cold temperature and your feed-forward control system is not strong enough. So what will happen? This decrease in skin temperature will subsequently decrease your core body temperature also. Now, if your core body temperature is decreased, again there are certain receptors at the level of these internal organs, and those receptors will again send signal to the hypothalamus. Hypothalamus will activate this heat production system, and this heat production will try to raise the fall of core body temperature. Means whenever the core body temperature is already decreased, this system is trying to increase the core body temperature. So when it is decreased, it is trying to increase the core body temperature. What type of system this is? This is typical of feedback type of control system. Getting my point? So when it is decreased, temperature is decreased, it is trying to increase your temperature, right? Okay, so this is typical of the negative feedback control system of thermoregulation. Getting my point? So thermoregulation has two ends. One is feed forward system, which is more common. Okay, when your skin temperature is dropped, but you are rising the core temperature ahead of fall. But when your core temperature is already down and you are rising it, then that is feedback, negative feedback control system of thermoregulation, right? So this is a typical example of feed forward control system. Second, increase in heart rate and respiratory rate. Look at the word, even before the start of exercise. If I ask you that you have to start doing exercise on this treadmill, okay, and you are taking some precautions, okay, because you are a sedentary person like me, so you are taking some precautions that you have to do exercise on treadmill. So what will happen? Your system will be already activated, your system will be activated inside your body, and that will increase your heart rate and increase your respiratory system. This is known as psychic stimulation. So you are just thinking that you have to start the exercise. This psychic stimulation is rising your heart rate, is rising your blood pressure, is rising your respiratory rate. This is typical example of feed forward control system, psychic stimulation, right? Third, cephalic phase of gastric secretion. You know cephalic phase? Cephalic phase means the food is only at the level of your mouth, or even if it is not at the level of mouth, suppose only you are looking at the food. Okay, so you are hungry, you are just looking at the food. What will happen? The acid secretion will start at the level of stomach. So basically, you can imagine a system like this. So this is stomach, okay. Your food is here at the level of mouth, okay. But acid secretion has already started inside the stomach. So what the stomach is doing? Stomach is taking some anticipatory precautions that now the patient is, now the subject is going to take the food and the food is going to reach at the level of stomach. So stomach is taking some anticipatory precautions. So that is nothing but feed forward control system. Next, receptive relaxation of stomach. You know, two types of relaxation of the stomachs occur. Okay, one is receptive relaxation and one is adaptive relaxation. Okay, receptive and adaptive. So what is that? So suppose the food is at the level of mouth and you are just swallowing the food. So whenever food enter in the upper part of the esophagus, the stomachs dilate. The upper part of the stomach relaxes or dilate ahead of food. The food you just is entering at the upper part of the esophagus and the stomach is stretched. Stomach is relaxing to receive the food. So this is known as receptive relaxation of the stomach. Relaxation of the stomach ahead of food to receive the food. Receptive relaxation of the stomach. That is typical of feed forward control system. But don't confuse with adaptive relaxation. Adaptive relaxation is not feed forward. What is adaptive relaxation? When the food is already inside the stomach, now the stomach will again relaxes to adjust this extra amount of volume or extra amount of food. This kind of relaxation is known as adaptive relaxation, which is not a feed forward control system. But the receptive relaxation is an example of feed forward control system, right? And the last one is written cerebellum. Okay. When we will discuss the cerebellum, you will understand the detailed connection. But for the time being, you remember that granular cells which are present at the level of cerebellum, they stimulate the basket cells. And basket cell, because it is an inhibitory kind of cell, basket and stellate, they inhibit the Purkinje cell. They inhibit the Purkinje cell. But this Purkinje cell has no control either on this basket cell or it has no control either on this granular cell. Means always the input is always, the output is always going in the one direction. It is going from the granular cell to basket cell and from basket cell to Purkinje cell. But there is no return back of this input. That's why this is again an example of feed-forward control system. When the output is always going in one direction, it is never returning back to original. So this is known as feed-forward or anticipatory control system. So this is all about your